Hi, this is Margaret Flowers with Breast Cancer Research Foundation. We're coming to you today to talk about how we can stay healthy and active during this time of COVID when we're kind of confined to home. And I want to welcome our guest today, Dr. Melinda Irwin, a BCRF researcher from the Yale School of Public Health. And Dr. Irwin, I want to thank you so much for joining us today and talking to us about what we can do during these times when we're kind of cooped up at home. We don't have our regular access to maybe our usual exercise routines, and what we can be doing at home, and particularly for patients who may be somewhere in their journey with breast cancer, either undergoing treatment or completed treatment. Maybe some advice for them as well. But I'd like to begin by, number one, asking you to kind of introduce yourself and talk a little bit about the research that you're doing with patients with breast cancer.
Sure, I'm delighted to be here. Thank you. So I'm a professor of epidemiology in the Yale School of Public Health, and I direct a research program that examines modifiable lifestyle behaviors for cancer prevention and control. And I've been really lucky to receive funding from the Breast Cancer Research Foundation to do clinical trials, specifically looking at these lifestyle behaviors such as exercise, nutrition, and weight management among women with breast cancer, and how these interventions or these behaviors impact various cancer outcomes.
Great. So on the subject of exercise, what is the link to lifestyle factors, including exercise, with breast cancer outcomes? What do we know about that today?
Sure. So there's been a lot of research showing that physical activity before a diagnosis of not only breast cancer, but about 12 other cancers lowers our risk of developing cancer. And we also know that if you exercise after a diagnosis of breast cancer and other cancers as well, we can improve our survival, our overall survival, and our cancer-specific survival. So there's a lot of literature showing the association between this behavior, physical activity, and cancer risk and mortality. And specifically here at Yale, we have been doing research on the role of exercise, nutrition, and weight management at 3 different time points after a diagnosis of cancer. We've been looking at how exercise, for example, before surgery for breast cancer can improve various tumor markers. We've also been looking at exercise, nutrition, and weight management after finishing treatment, chemotherapy or radiation, showing that it improves various immune and inflammatory and insulin pathway markers that we know are related to cancer risk and mortality. And more recently, right now, we're doing a trial among women receiving chemotherapy for breast cancer, and how exercise during chemotherapy, as well as nutrition, can improve chemotherapy completion rate. This is really important because we know upwards of about 50% of women do not complete their chemotherapy regimen that's prescribed to them, and that's because of side effects. So we're looking at how exercise can improve the side effects of chemotherapy, as well as nutrition, which in turn will improve their chemotherapy completion rate. But what's really interesting right now with the coronavirus is that certain chemotherapy regimens are being changed to more dose-dense therapies, and this is to limit the amount of visits to the hospital. So our intervention right now can look at how exercise and nutrition might impact chemotherapy completion rate for dose-dense therapies and other therapies that have longer cycles. And we're able to do this because our intervention is telephone based. And so we haven't had to stop our study right now. Even though people are confined to their homes, we're able to continue our intervention because it's telephone based.
That's just wonderful. I mean, that was going to be my question is, how has this been impacting the success or the progress of your research? That's fabulous to know. And that's a whole nother subject about how, remote access and the technology is going to change how we are able to involve more patients in clinical trials. But so it sounds like the benefits of exercise sort of are, at every phase of the cancer journey, there are benefits to exercise. And I realize that, a patient who is undergoing treatment, or even someone who's completed treatment, there are challenges in being able to exercise. And so, when we add to that, the restrictions that we have by staying at home during this time, um, adding to that, just the challenge of being able to exercise when you're undergoing treatment or have completed treatment and maybe have some sustained side effects. What's your advice to patients, as well as those of us who are healthy and want to stay somewhat physically active while we're stuck at home?
Yeah, so most everyone knows that exercise is beneficial, but many of us struggle to add it into our daily routines. And so there's a number of reasons for that. Prior to COVID, it would be that we're very busy. We spend a lot of time commuting to and from work, and we're still busy now with many Zoom calls and helping our kids with online education. So there's always the time issue. There's the fact that where we might live, our location, it's not safe. We don't have streets that are lit. So there's a challenge of a place to exercise. And then there's weather related issues. And then lastly, some people just don't find exercise to be enjoyable. So, a lot of the advice we give to our study participants is, one, it has to be enjoyable. It has to be something that you find fun and that you enjoy doing. And the research has shown that the biggest benefit for exercise is when you go from nothing to something. So it's not, while the recommended amount is about 30 minutes a day or about 2.5 hours per week, really doing anything is better than nothing. So not to focus too much on the intensity or the duration or even the type of exercise, but first and foremost to focus on something that you enjoy doing. And then from there, adding, the duration of maybe up to 30 minutes a day, and then the intensity level is important. So I think, now that we're kind of homebound, some of the strategies are really kind of prioritizing it. So that's why a lot of the research that we and others do is still really showing the mechanisms of how exercise can improve not just cancer outcomes, but cardiovascular disease, diabetes, and other cognitive function and other outcomes. Because when we know more information of the benefits, that can help motivate us to do it. And once we're motivated, we prioritize and schedule it. And so there's other tips to help get exercise in. Some people know if they don't get it in first thing in the morning, they're not going to get to it later in the day. Others wake up and they have too many other things that they need to do. And so finding time in the afternoon is a good approach. Exercising later at night helps us digest our dinner, helps us sleep better. So thinking about it that way, if you're having trouble sleeping, when can you time your exercise to be beneficial to you? But I think right now at this time, we want to think about anything is better than nothing. And, waking up, since we're at home, waking up and dressing in our exercise gear. So if we have 15 or 20 minutes, we can easily pop out the door if you live in a neighborhood where you can go for a walk or turn on an online class or something like that.
So are there exercise strategies in terms of, you referred to online video things, that especially for people who maybe don't have a regular exercise routine, and then are challenged by just the all of the adjustments that we're making being at home. We may be sharing a space with family, pets and other things, and so not having the space, or are there any go-tos that you like to recommend for folks that maybe don't have a lot of room, things that can maybe bring the heart rate up a little bit, to get the most benefit out of exercise?
Yeah, so if you're truly homebound, say living in an apartment in a city, and you don't really want to go outside, there are so many different types of classes online or Even if you're on Facebook or other social media, people are posting videos. And if you're new to certain routines, there's 5-minute showing how to do certain floor exercises. So if you have a space that's just enough next to your bed or next to your couch to be able to do some floor work, there are many videos online showing that. Personally, because it is spring now here, if you can walk outside and you can maintain social distance from people, doing a weight-bearing activity such as walking is really going to help us maintain our lean body mass. And if you can do it at a moderate intensity where you're getting your heart rate up a bit, trying to do that for upwards of 30 minutes, that to me would be my recommendation. It can also help our quality of life, our stress, anxiety levels. But if you want to stay inside, then there's many videos online that can help. And one important thing too about exercise is we know that social isolation can cause stress and anxiety. And the way we measure this in our blood is actually through, or saliva levels too, is through cortisol. And we know exercise can improve cortisol levels. And so by exercising, can help with the stress and anxiety we feel with social isolation. So that's another benefit of exercise, in addition to the cancer-related outcomes.
Going back to something you mentioned earlier on about the research you're doing at Yale, you had mentioned that some interventions were able to have an effect on immune markers, I believe. So is there, is there any evidence that exercise can, if we're exercising and we do come down with the COVID sickness, that, it could modify, it could reduce the effects of getting sick, or be a preventive measure because of that immune enhancement quality of it?
Yeah, this is a really important topic, and I imagine there's going to be a lot of research on this going forward. But we do know that exercise has a profound impact on our immune system. And we know that when we do an acute bout of exercise, so right when we're exercising, there are certain proteins released from our muscle. They're called muscle-derived cytokines, such as interleukin-6 or IL-6, IL-7, and IL-15. And these cytokines are released into the blood to help viruses, to help our immune function. And so there have been a number of trials done of exercise on these immune markers for a number of diseases: cancer, cardiovascular disease, diabetes. And so there hasn't been any current research looking at exercise with coronavirus or COVID-19, but we know that the mechanisms might be similar, and that is through the inflammation and the immune pathways. So while exercise is not going to, say, prevent us from getting the virus, it might attenuate some of the side effects associated with COVID-19. And in certain patient population groups, it might even be more beneficial than others, such as older individuals or those with a higher body mass index.
Mm-hmm. Well, I think the message here is there are just too many reasons not to exercise. So I want to thank you again for this really, really valuable information. I'm so thrilled to be able to share it with our audience. Before we sign off, is there any last things that that you could advise us on for staying healthy and stress-free as much as we can during this time?
Yes, of course, we want to follow all our guidelines. We want to make sure we're maintaining our social distance at this time right now, and wearing our masks if we're out in public. But I think exercise is really beneficial. If you're finding it challenging to motivate, what I do is I always think of the benefits and how I'm going to feel after I finish a workout. There's very few people who don't feel good after they finished an exercise session. Right. So I'd like to say thank you to all our healthcare workers out there, and we're going to get through this. So thank you.
Thank you so much, Dr. Irwin. Stay safe.